Assalamu alaikum and hello everyone. So let me first check if I am being on live properly. I know this time is not working for everyone, and one of the reason is because I'm still stuck in Bangladesh and am planning to go back to Canada on the 14th or wait, 12th of March. Still a long way to go. Anyways, before some of you people hop on, I want to let you guys know a little bit on what to think about this today's live. Okay, so the background of this is my son is very ill. He is having quite a bit of fever, so I had to do it now in between his nap, and he might wake up during his nap also. So I was like, it's either showing up to you guys or not do it at all. Okay, showing up at this time and not doing it all. And I was like, let's just come and have a quick live, not like maybe a 1 hour long session. This will be a shorter one. Okay, so without further ado, let's just jump into today's session. Okay, so if you are live, please give me a hashtag live and let me know in the comment if you have any question related to the topic today. Okay, and if you are watching this on replay, give me hashtag replay. And also let me know in the comment what are your top burning questions and you would want me to answer them in future. Okay, so let's hop onto it. The first question is, I guess this is a very important one and on the forefront of everyone's mind, on every autism parent's mind, and that is how much change or recovery is really possible for my child. Okay, so the first things first, we are not talking about curing autism. It's not a disease that we are curing. Okay, totally not. So what do I or somebody who is working in this way mean by autism recovery? Okay, so by using the term autism recovery, I actually mean that we are able to get back a lot of the developmental milestones that our children lags behind. Okay, for example, speech, then communication, social skills, behaviors, and things like that, because neurodiverse brain is not really going to be neurotypical brain, and you do not need your child's brain to become neurotypical. Okay, uh, everybody, please let me know in the comment if you can hear me clearly or am I just speaking to myself because I was having a little issues this morning when I was speaking to one of my students. Okay, so your child, whether he is neurotypical or neurodiverse, has all the right to have a healthy, happy, and successful life. Okay, so if you are struggling with making your child eat food, taking care of him, making him independent. He cannot communicate with the world. He cannot communicate with you even. Is having uh, other issues, mood, tantrum behaviors, and things like that. So that child is not a happy child. That child is not achieving the developmental milestone needed for a child to thrive or to become successful. Okay, which is why what we are all about in Autism Success Academy. Okay, we are all about giving you and your child, both you and your child, the success needed for you both to thrive in this world. Okay, so autism recovery is possible to the extent that the child's brain and body allows. Okay, it's not like your child is totally becoming neurotypical, and I don't think you really need that, as I said before, but you certainly, most certainly, can recover speech. Okay, you can recover good behavior, you can recover happy, healthy physical and emotional well-being. You can recover communication. You can recover social skill. You can make your child independent. Okay, independent as in potty trained. He is able to self-feed. Your child is able to take care of himself and communicate his needs to the world, make friends, be in school, listen to the teacher. listens to the commands, whatever commands that you give him, he understands them and he performs based on them. So all those things are totally possible to achieve. Okay, the timeline is pretty much between a few months to 1 or 2 years at most. Okay, why is this? Well, a person's, I would say a child's brain develops in segments. Okay, if you have watched any of my lives about autism recovery, you will know about it already. So uh, a child's brain develops in segments from birth. Even before birth, also your child's brain was having the developmental progression inside your womb, and after birth your child's brain is also keeping on going with the flow of improvement. Okay, and whatnot. So the thing is, a human brain needs about 11 months to sometimes 2 years to have a lot of rewiring, okay, healing of the brain, because the brain has two hemispheres, if you know your basic science, the right hemisphere and the left hemisphere. So the right side of the brain is actually the one that is making sure that your child that ensures that speech, language, communication, understanding the world is there, and the left side of the brain is there for creativity, for visualization and things like that. So for your child to be able to perform at his best, to be able to become independent, be able to take care of himself and pretty much thrive and be successful in the world, it takes the body and the brain somewhere between 1 to 2 years, okay, to become its best, most healthiest self. Okay, this is an English speaking live. I have planned to do in Bengali. Okay, so you might wait for them in future. But this one is basically for my all my viewers who understands. Okay, who understands English. But I have planned in future to speak to have lives in Bengali. Okay. All right. So it's totally possible to have your child recover as much as possible of the delays that he has and be able to reach the milestones in record time if you give him or her the support your child needs. Okay. All right. So the next question is, will changing diet do the trick? Well, diet alone will not help you or your child do the full spectrum of recovery. Okay, because diet is just one part of health. A person's health actually is based on four, we call this four quadrants of life. Okay, the first one is physical health, second one is mental health, emotional health and spiritual health. Okay, so if you change diet, what happens is you are making your child have all the nutrition, or less toxin is produced and whatnot. You are giving him the diet part, the nutrition, the vitamins and minerals and stuff like that, but your child also needs environmental support. He also needs a lot of deep detoxification so that your child's body and brain can let go of a lot of the toxins that is built up because of the food that he has been eating, because of constipation, because of lifestyle issues, and the modern life itself is very toxic in nature. Whatever we eat, it has it has chemicals in it. Whatever we breathe, even the air has chemical in it. Even the air has toxins and poisons in it. Okay, so for recovery or transformation or success, whatever word you use to make sure you understand the concept, your child actually needs five things. Okay, the first one is diet, the second one is deep detoxification, the third one is a holistic lifestyle. Okay, the fourth one is specific parenting, because your child needs a different sort of parenting situation rather than a neurotypical kid. Okay, and the fifth one is a stable mom or a stable parent. Okay, so for the second part, the first one is the diet part. So if you totally focus just on the diet, you will miss out on a lot of chances to have the best result. Okay, because if your child is addicted to gadgets, if your child is not sleeping on time or is not able to sleep longer, then the brain actually is not getting enough time to heal. Okay, so the brain needs somewhere, depending on age, somewhere between 8 hours to 12 hours of sleep uninterrupted. So if your child is watching a lot of uh, blue light emitting gadgets, that affects his brain. If your child is not if your child is, let's say, staying in just inside the house, it's not, he or she is not going outside in the nature to play in the nature, so that is also affecting his health and well-being. Okay, because we all know the importance of fresh air, the importance of walking on the bare ground, the importance of sunlight, playing outside and whatnot. Okay, so the second part is detoxification. The third one is holistic lifestyle. The fourth one being parenting, because you have to understand whether if you, let's say your child is having a meltdown. Okay, so what do we think about meltdown? A meltdown is when a child is, to us, unnecessarily or crying without much of understanding the situation. Okay, or your child might throw a tantrum. And what is a tantrum? A tantrum is when your child is like, you have to give him something. You're not trying, you're trying to avoid something for him, but your child is like, no, he's controlling the situation and he wants that stuff from you. So you, being a parent of a neurodiverse child, you have to understand the my kids are there in the background. So you have to understand the difference between how his brain works, and how, what's the difference between tantrum and meltdown. Okay, and how you can handle your child when your child is going through a stage of tantrum or meltdown or any specific criteria, anywhere in between that in that continuum. Okay, all right. And apart from that, the fifth part, which we talk a lot about, is the emotional piece, because we all are made of energy. We are all energy. Everything in this world is energy, and that means we all have frequency. Okay, so if you are happy, you have a higher energy. If you are sad, exhausted, upset, anxious, you have lower energy. So when you are at a lower energy, it's very hard for you to take care of your child, take care of yourself, take care of your family in general, and make sure that you all are happy, healthy, and successful, right? So which is why you, as a mom, you need to take care of yourself. You need to know how to be able to do that, to make sure that you can have the best life possible for you and your children, as well as have a family life. Because we all know that special needs parents actually don't have much of a family life, I would say, like a romantic relationship with husband, or maybe a more joyful life. Okay, more joyful life. So we all need all those key pieces. So before I move on to the third question, here's a question from someone. Just a question: how do I handle a child who sleeps till about midnight, then awake till 3 or 5 a.m.? He has no technology. Okay, if it's not for the technology is not the only reason. If your child is unable to sleep through the night, okay, the major reason is the brain in hyperactivity mode. Okay, if you follow through my written post a few days ago, also I shared something like, if your child is having high sugar or starchy food or grains, those kind of food, actually your child cannot digest properly, and they create undigested chemicals and toxins which affect the brain, which also affect the circadian rhythm. Okay, so a circadian rhythm is when our body is tuned with the sun and the moon. So when the sun rises, you wake up. When the sun goes out, sun sets, and at night you want to go to sleep. Okay, so what happens is, due to a lot of factors, apart also, and apart with technology, there is also the lifestyle piece, there is also the food wise, because I have seen, whenever we change the diet from whatever your child is having right now to having processed food free, sugar free, preservative free, grain free, and milk free diet, then the child's mood, behavior, sleep radically changes. Okay. And if you can give your child the support of detoxification, then it's a lot faster. You will achieve his sleep. I'm not sure whether you just mentioned a child. I'm not sure it's your son or daughter. So that pieces, when falls together, you will be able to achieve a lot of nice sleep for your child as well as yourself. Okay. And then another thing is, are you sure you take him to the nature, get him to play outside, and you know have like walk on the forest, or if not forest, walk on grass. Okay, all of those pieces actually is very important. The fact that we think that that our life is just bits and pieces, some stuff around, it's not like that. A human being, be it a child or an adult, for us to be able to thrive, we need to ensure the four quadrants are in order. Okay, so are you a mom who is anxious? Are you a mom who's exhausted? Are you a mom who's totally stressed out and frazzled? And is your home environment not much conductive to, how to say, like, peace? So you have to think about those factors as well. Okay, and you can also go to the guide section. I have created some lives already about it and trainings, and I will be creating more. Okay, so no sugar, ADHD, global delay, learning difficulties, and ASD L3 level 3, has a lot of allergies. That's his diet, a lot of the diet. Yeah. Okay, so he does not have sugar, very good, but he has ADHD. Okay, so when your child have ADHD along with autism, what happens is your child cannot, even if you're not giving sugar, you are giving him grains, right? So grains, when digested, produces sugar, by the way. So what happens is that sugar, when it goes to the blood system, blood, insulin is produced, and then it tries its best to lower the sugar level. And if your child sugar level cannot be maintained and balanced properly, the brain does not know, and the body does not know how to let go of the excess glucose, excess energy. That's when the hyperactivity is occurring. Okay. This is for my son. He will be 7th in May, and he's also very physically violent in the morning before he has his meds. He is in medications. Okay, that's another whole lot of different aspect that it takes a lot of time to discuss. By the way, the thing is, when we are in medication, our any medications that affects your child's brain affects it negatively. I'm speaking from experience. I'm a pharmacist. I know what goes on in all those drugs and medicines that we are being prescribed. Okay, so are you feeling okay? Okay, my son just woke up. All right, so I know I have said that today is going to be a little shorter live. Well, I have another question. Hello, doctor. Could you please explain more on detoxifying and grain-free? And is rice considered a grain? Rice is considered a grain. Well, the first thing is, if you want to know more about grain-free, I have a training. It's called How to Go Grain-Free. It's in Guide 2 in the Autism Recovery, not recovery. We have changed the name. We have rebranded the Autism Success Academy. So we have that guide in the group. And if you're not watching this from the group, I highly suggest you join our group. And if you cannot do that, you can watch all those videos in my YouTube channel as well. Okay, it's under the name Dr. Tasnova Tunna. And if you want to know more about detoxifying or detoxification, I have done live, two live actually, on this topic, and you can watch them, because today it's mostly about the three questions that I usually get a lot in my DMs, and I thought I would just come in and then share with you guys about my view about it. Okay. What is the difference between ADHD combination and ADHD? It's not totally sure. I mean, your question is not really clear, but I think you mean ADHD and autism versus only ADHD. If it is that question, if you mean that, your child having autism and ADHD is, it's a hard combination to handle. It's a hard combination to handle, and I have full support and respect and love for you. You're going through a really tough time. I understand that. So when your child has autism, he or she already has a lot of developmental delays. Okay. So if your child has a lot of developmental delays, the brain already is functioning, not functioning at its best. And if your child also has ADHD, then what happens is the brain cannot focus and function even better. The thing is, you know, ADHD, ASD, PPD, and all those things, these are terms which helps us to understand and separate and try to understand. It's a way of us to understand our child. Okay. But essentially anything that affects the neurodevelopmental progression of the child affects his mood, affects his sleep, affects his communication, affects his social skills, and everything in between. Okay. And if somebody tells you cannot recover good behavior, you cannot recover speech, you cannot recover focus and attention for ADHD, it's not right. Okay. You actually can do all of those things if you focus on the five key pieces that I've said. It's the diet. Okay. It's the diet, it's the detoxification, it's the parenting piece, it's the holistic lifestyle, and then working on yourself as well. Is it normal for the combination to be very violent? Yes, it's very, very normal. As I said, I have full love for you. Are you a sister or a brother? The thing is, I'm using StreamYard, a platform to be able to stream to multiple pages. Okay, which is why I cannot see your name. I am very sorry for that. Next time, could you guys please just accept the, StreamYard posts link? If you just accept that link, then it will be able to show me your name. You are a mom. Okay, sister. First of all, it's a very deep conversation, and I have plans on writing about them and making videos in future. Holy, thank you so much for being here, Holy. Thank you so much. You are Holy, okay? And you are raising a beautiful neurodiverse child who has pretty violent nature, and you might feel like there is nothing to be done, but you can do a lot to improve his mood. You can do a lot to improve his mood. The first thing that I suggest, because it's not possible for me to go through that whole conversation now, okay? So the first thing that you can do is please go to the group if you are not already there. There is a guide 2. In the guide section, there is guide 2, and there are all the lives that I have done so far, all the trainings that I have done so far about most of these topics that I'm talking about today. Okay. And after that, could you just give me like post specific questions, and then I'll come back and then either make a written post or I'll do a in-depth training. So today I cannot do like a training. Today we are doing like just a simple Q&A and a short one because my son is very sick. Okay. All right. So I want to just go to the third question. Let me hold on my phone. Okay. So the third one is, if my child is severe picky eater, how am I going to change the diet? For that question, I have made 2 very in-depth training, and I would want you guys to go through the guide section as I said. But as a summary, your child being a severe picky eater tells me that he is not actually a picky eater, he is a problem feeder. When you understand the struggle of your child, you will understand what to work through and how to work through that. So when we say a child is picky eater, it means he has a personality of not trying new things. Okay, so what it tells me is your child is a problem feeder, and problem feeders are problem feeders because of sensory issues and because of a lot of toxins in their brain and also in their gut, which creates this difference in the tongue, because our tongue is the place where we taste sweet, sour, salty, bitter, and all those flavors, right? The thing is, when your child's gut is imbalanced, the whole entire digestive system is kind of imbalanced. And we know it very well that our mouth also has a lot of bacteria in it. Okay, so if there is high amount of bad bacteria, what it does is when you give him healthier foods have chemicals like phenols and other stuff, which makes the child feel like, like icky or biting or burning sensation, and which is why he has kind of an aversion towards trying new food or healthy food. So if you are having a severe picky eater and you really are struggling with moods, violence, and behavior, social progression, and other things like that, I highly suggest you think deeper on getting more into how you can help him. Okay, because whether you work with me or whether you work with someone else, it's totally up to you. But your child will do a lot of benefit if he goes through a very gentle and deep detoxification. Okay, because when he does that, it will be very easier for you to change the diet without all those struggles. And we do it every time. We do it every time with every single picky eaters that I have worked with so far. We were very much able to change their diet without the frustration and exhaustion. Okay, so is that Holly asking the question, or someone else? I have 3 children with ASD level 3, and oldest and youngest as the other problem as well. The youngest is non-verbal. That's very, very tough indeed. 3 children on the spectrum. Well, the first thing I want to tell you, you are not guilty of anything. You did not do anything wrong. You tried your best. No mom actually to want to have a child who is having difficulties like the ones our childs have. Okay, and there is, I personally think there is nothing much to over glorify autism or neurodiversity, because it's still a struggle. I myself am a neurodiverse, by the way. I'm not a neurotypical person talking about neurodiverse people. I am a neurodiverse human being. I have gone through a severe childhood trauma. I was beaten nearly every single day because I could not remember stuff. I could not understand commands. I could not understand the world. I could not memorize. Okay. So, all those traumas at home, in school, in college, in universities, and all those things in between, I have learned how hard it is for a neurodiverse to be successful. Okay. Which is why when I was able to work through my son, I shifted my whole career. Okay, I came in here because I felt this is my life's purpose. This is why I was born. I want to ensure and make sure that I help as many parents understand their neurodiverse child and give them the best support that the child needs, because neurodiversity is really cool if the neurodiverse kid gets the support needed for him to understand the world, make a place in it, and thrive. Okay, so if your child is violent, cannot sleep, cannot eat properly, gets sick, okay, and so many other stuff that we go through, it's not really glorifying that, or how to say, what's the best word, It's not ableism. If you want to help your child become the best version of himself, it's your duty, it's your responsibility. So if somebody or agencies tells you to do stuff that you in your gut think is not right for your child, don't do it. Okay? I have had so many false reports to child protection. It's not funny. I totally understand. Totally understand. The thing is, we can try our best to create awareness, and we are all trying our best to create awareness about the difference between neurodiversity and neurotypical. But here is the thing: only 1% of the human population is neurodiverse in nature, which means among the 7 billion, only about 70 million of us are neurodiverse. Do you think the other 6.3 billion will change everything because of us? Do you think the world will change? The whole world, the 99% of the world will change the way they perceive and think just because the 1% is not able to understand the world? It's a tough question. I get attacked by a lot of people when I ask this question. The thing is, the child is not happy, the child is not successful, the child is not healthy, he is struggling, the child needs help. That does not mean we are demotivating the parent to not love their child. We are demotivating the child, saying that you are not good enough. The child is good enough. The child needs support to become the best enough version. And every child has deserves that. Every mother deserves to have an exhaustion free life. Okay? Every mother deserves to have a child for whom she does not have to lay awake every single night because she's scared. When is the next call coming from the protection agency? When is the next call coming from the school? When is the next call coming from the therapist, or play dates or friends and things like that? Right? So pave, you cannot, the best thing is to make your child ready for the road rather than the road for the child, or something like, don't pave the road for the child, pave the child for the road. That does not mean we will stop creating awareness. That only means that our first focus is to help our child. 70% of our focus should be helping our child with whatever best outcomes and abilities we have at home. And the other 30% is talking to the people, creating awareness, talking to the school, talking to the agencies or wherever needed for you to speak, so that your child gets the best support everywhere. Okay? Just wondering, is it okay to have locks on the doors to protect them while off meds and to protect the rest of the family? If you think about, well, I don't think that harshness is actually necessary. But yes, protection comes first. Nobody else will understand what you are going through. Okay? Protection comes first, but make sure your child is safe. Because if you lock him outside and then there is an accident and somebody forgets about the child will be locked there. Just make sure that your child is safe, you are safe, and everybody in the family is safe. And the first thing that you should give it more thought is to get the best support for him, get the program, get the coach, get the whatever that you think, you believe in your gut will help your child to overcome all of those things, because it's totally possible. We do it all the time. It's totally possible. It is totally possible to come off the medicines that is given for his violent nature, because the violent nature is there because of the imbalance in the body and the brain. So getting a medication from outside of the brain will not stop the brain from doing the harm, the self-harming or harming others. Okay? It's a short-term solution. Your child needs a long-term solution, so do you guys. Okay? So I invite you all, you Holly or anybody else listening who has situation like this, is to give this a really deep thought. Okay? Because it's not fun to It's not fun to sleep just 4 hours at night, right? And it's really tiring and it's really exhausting, and you don't have to be have that life. I used to have that life, by the way. I was suicidal. I could not sleep because my son would sleep like, 4 or 5 hours in the whole day. And then I had a newborn. Life was super crazy, but it's totally possible. And it's not like I just did it one time. We are doing it every single time. So I am very much sure we can help your child as well, or you can help your child. Go through the guide section, do the in-depth trainings, sit down with your spouse, make some changes, decide that you want to change lifestyle, you want to change the diet, and then work together like a team. Okay. All right. So I think I have came to the end of the questions that I have prepared for today, and I wish I could have stayed longer because it's really fun to have talk to you guys and come on calls like this. But the thing is, until I go back to Canada, I just have to work through with whatever time, with whatever resources I have here. Okay. It was lovely meeting you, Holly, even if it's virtually and I can't see you, but we will meet someday, inshallah. Okay. So I just have to go off. If you have more questions, please come back with hashtag replay and then have your questions. I am planning to come in more than once live once I go back to Canada. Until then, take care. I love you guys a lot. Bye. Tata.